This hospital was one of the city's dedicated COVID-19 centers. Outbreaks overwhelmed its facilities, canceling surgeries and exacerbating staff shortages. Now the head of its ICU says the pandemic highlighted just how critical it is for hospitals to be fully staffed at all times.
There was a lot of patients, not a lot of people to take care of them.
Dr. François Marquis explains at least 6 of the 26 ICU beds at his hospital were closed in mid-February. There weren't enough nurses to open them around the clock. This was his ICU in January 2021. Shortages were a problem then too. He says the lack of space and staff puts the province at a disadvantage, but the experience has prepared hospitals.
I would say that we would be ready to optimize in a faster way.
Quebec's emergency rooms are dealing with similar challenges, says Dr. Gilbert Boucher.
The emergency system, tomorrow morning we couldn't take the influx of a lot more patients, but hopefully in the next few weeks we could mount a response for sure.
He adds at the start of the pandemic there was a disconnect between frontline workers on the ground and decision makers.
Sometimes we had to use the television to pass on the message because there was no answer. So right now the channels are much better open. We can discuss things, and we're having meetings every 2-3 days right now with the influenza season.
Epidemiologist Nima Mashouf says she's skeptical the province has made enough progress in the last 5 years. She says ventilation in government buildings and schools is subpar, plus more privatization worries her.
The principle of the private system is to make money, to make profit. The duty of the public is to preserve the health of the population.
Mashouf adds Quebec was caught off guard.
They didn't take it seriously, I think, at the beginning.
CTV sat down with Quebec's public health director, Dr. Luc Boileau. He admits the province was underprepared for COVID-19.
I think that we are much more prepared than we were for the last that we had. At that time, we were not expecting something like that to happen as dramatically as it happened.
Boileau promised a provincial pandemic plan by 2025. To date, it hasn't been published. He says the arrival of Santé Québec has led to some delays.
It should be certainly ready in a few weeks or a couple of months from now.
The health agency is working to cut $1.5 billion in spending while medical institutions across the province grapple with staffing shortages. Health authorities have reportedly eliminated hundreds of their job postings for nurses.
The lowering of capacity, financial capacity, is something true, but we expect Santé Québec to be able to cope with this particular important situation and make sure that the healthcare system will be still very strong.
Boileau says COVID-19 still leads to deaths every week. The province is staying vigilant, watching out for avian flu, as well as a new bats coronavirus, which is sparking some concerns. The director adds preventing another crisis will depend on making sure that we don't forget the lessons learned. Maria Saru, CTV News.